A very good morning to you all. Today we will be covering a very important topic, one of the most important topic in basic epidemiology, and that is association and causation. So the objectives of today's lecture will be that at the end of the lecture you should know what is association and what is causation. Most importantly, you must understand what is the difference between association and causation. You should also know about the types of association with their examples, as it is asked in exams. You should also know about the criteria for establishing a causal association, right? So these are the 4 objectives that you should concentrate while seeing this lecture. First thing is, what is association and what is causation? Association is nothing but the concurrence of 2 variables more often than would be expected by chance. So there are 2 components in this definition. The first component is that association is concurrence of 2 variables, when 2 things occur simultaneously, one after the other or at the same time. So 2 things are occurring together, right? And how often are they occurring? They are occurring more often than would be expected by chance. Okay? So when you are exiting the library and you keep bumping into some friend of yours, more common than it is by chance, then you could conclude that leaving library is associated with bumping into some particular friend, and that phenomenon needs to be investigated further to get to the bottom of it. So concurrence of 2 variables more often than would be expected by chance, right, is known as association. Whereas causation is any event, condition or characteristic which plays an important role in occurrence of outcome. Okay, so basically causation can be the definition for causation can again be divided into 2 parts. First thing, it might be a causal phenomena, might be an event, a condition or a characteristic of an individual, and that particular thing plays an important role in it occurrence of a specified outcome. For example, obesity may cause diabetes in due course of time. So obesity is a characteristic of an individual who is likely to develop diabetes later in life. Okay? Association is concurrence of 2 variables more often than would be expected by chance, whereas an event, condition or a characteristic which plays an important role in occurrence of the outcome is known as causation. The most important dictum that you must understand is that just because 2 things are associated together does not mean that there is causation, right? Just because you praying during an IPL match was associated with your favorite player scoring good runs doesn't mean that your prayers have caused him to perform well, right? So association does not imply causation. Simple example. So stress in medical students has been found to increase during winter season. So we can say that stress is associated with winter. But why is this so? Is it actually winter that is causing stress? So now that winter is coming, you might have started to feel a little bit stressful. Upon further investigation, we find that university exams are often scheduled during winter time. So it is actually the exams that are causing the stress and not the season, right? So stress might be associated with winter season, that is, you might find that stress increases disproportionately during winter, but that stress is caused by impending exams during winter. Okay, so this is the difference. Another important thing you must know is correlation. We often use this term in day-to-day speech, but it has a specific scientific meaning. So correlation gives you degree of association or strength of association. When we say that studying 4 hours a day is correlated with high academic performance or better academic performance, we mean that there is a very good chance, a very strong association between studying regularly and getting good marks in exams. Correlation is often denoted by a correlation coefficient which varies between the range of -1 to +1. So -1 और +1 के रेंज में correlation coefficient घूमता है. If the correlation coefficient is -1 or near to -1, then we say there is a strong negative correlation. That means when one thing increases, the other things will decrease. That is similar to indirect proportion, what you studied in physics. So when one thing increases, the other thing will decrease. That is negative correlation, strong negative correlation. So if you are exercising regularly or if you are reducing the salt in your diet, then your blood pressure will normalize, right? So if you begin losing weight, your blood pressure will normalize. So blood pressure and weight, they will both fall at the same time. Or if you let us say if you start eating healthy food, the chances of getting lifestyle diseases reduces. Okay, so improvement in your diet will be correlated with reduction in risk of getting lifestyle diseases. So there is a strong negative correlation. When the correlation coefficient is near to 0, we say that there is no relation between these two variables. Whereas if the correlation coefficient is positive and near to 1, then we say that there is a strong positive correlation between two variables. For example, consuming iron supplements or iron rich food and improvement in hemoglobin. So as you start consuming iron rich food, your hemoglobin will also increase. So that would show a strong positive correlation over time. Again, the most important thing to know is that correlation does not imply causation. Just like association does not imply causation, correlation only gives the degree or strength of association. It does not imply causation. Now, what are the types of association? Association might be spurious association, that is fake association. It might be indirect association, or it might be direct association. In direct association also, we say that the association is one-on-one or causal association, or it might be a multifactorial causal association. The first type, spurious association. Spurious, it means just fake, not real. Okay? Spurious association may occur due to bias, error, improper study design, improper data collection, or improper data interpretation, right? So just incidental association. If you study, you can find association between anything. You can find association between the phases of moon and the mood of your girlfriend also. But that is a spurious association. It does not have any scientific basis, and it may lead to bias or erroneous conclusions. For example, a study found that perinatal mortality or maternal mortality was found in found higher in deliveries conducted in a hospital as compared to home deliveries. So what conclusion does that suggest? That home deliveries are safer than hospital deliveries. Women are actually dying if they go to hospital, and they are surviving more often when they deliver at home. But there is a bias here, which is the Bergson's bias. And what does it say? Actually, normal deliveries are often conducted at home, but whenever there was any complication, those complicated patients only used to come to the hospital, and obviously complicated patients would have higher mortality as compared to normal patients, right? So obviously the home deliveries showed better outcome as compared to hospital deliveries, because hospital deliveries were more complicated, right? So that led to the false conclusion that death rate of women in hospital was more as compared to those who delivered at home, right? So this association was found to be spurious, and the hypothesis was discarded. The second factor is the indirect association. Now certain things may have an indirect association. For example, association between variable of interest and disease due to presence of another factor. And this another factor, which is associated with both the variable of interest and disease at the same time, is known as confounding factor. This is very important MCQ question. Also, you may get a short note or a short answer question on confounding. So let us understand what confounding is with an example. A study was conducted which found that people who drank coffee often had heart disease, right? But the coffee had a lot of sugar in it, right? And it was hypothesized that the sugar in coffee was causing heart disease. Upon further investigation, it was found that people who drank coffee with a lot of sugar also smoked a lot of cigarettes, and smoking was actually what was leading to heart disease in that particular group of people. Now it is true that coffee drinking can cause heart disease up to some extent, but cigarette smoking is more of a culprit when it comes to heart disease. So cigarette smoking was contributing more to heart disease than coffee drinking was. And the study erroneously concluded that it was coffee that was causing heart disease and not the cigarette. So in this condition, our variable of interest is coffee. Our dependent variable is, or outcome is, heart disease. And the confounding variable, that is a variable which is associated with both the variable of interest as well as the outcome, was cigarette smoking, right? There are a couple of more examples given in the textbook. I suggest that you memorize at least 2-3 examples when you are writing your answer. The third type is direct association. Now we saw the spurious association, that is fake association. We saw the indirect association, that is due to confounding. And the third type is the actual direct association, which is one-on-one causal relationship or multifactorial causation. So what does one-on-one causal relationship mean? One-on-one means that one thing is causing another thing, right? So if one cause is present, it will invariably lead to the disease. In this causal relationship, the variable or the implicated factor is necessary as well as sufficient to cause the disease. It is very important statement, again an MCQ. In one-to-one causal relationship, the causal factor is necessary as well as sufficient to cause disease. For example, presence of Vibrio cholerae is both necessary and sufficient to cause cholera. So if Vibrio cholerae is present in the person's gut, it will invariably, it is necessary to have Vibrio cholerae first of all, otherwise the patient will not get cholera, he will get some other disease. But Vibrio cholerae is specifically implicated in causation of cholera, and it is sufficient in itself to cause cholera, right? So similarly, Mycobacterium tuberculosis is necessary to cause tuberculosis, but it might not be sufficient. Associated immunodeficiency or other factors might be required to actually manifest tuberculosis. Whereas with Vibrio cholerae, it is both necessary and sufficient to cause the disease. So one-on-one relationship is direct relationship. It is often found in infectious diseases. So the agent, whatever infectious disease is there, Plasmodium falciparum for example, is necessary and sufficient to cause malaria, right? So more commonly seen in one-to-one causal relationship is more commonly seen in infectious diseases. But you must consider that often a single factor may cause multiple illnesses. So for example, staphylococcal infection or streptococcal infection can lead to multiple manifestations, right? So one agent may cause multiple illnesses, or multiple factors may be required to cause single illness. Okay, so family history of diabetes, that is genetic predisposition, as well as dietary habits, as well as lack of exercise, as well as addictions, they all come together to lead to lifestyle diseases such as cancer, hypertension or diabetes. So often most non-communicable diseases require multiple factors to come together to cause the illness. Okay? Therefore, one-to-one causal relationship, although it is ideal, may not be found in every situation. So there are very few conditions where you will find direct one-to-one causation. Mostly it is multifactorial in nature. So what is this multifactorial causation? Multifactorial causation is nothing but causation where there is no single factor but many factors which come together or which independently cause the disease. You have already read about it in your first chapter of Park's textbook in Web of Causation. First as well as the second chapter mentions web of causation. So it is an interrelated presence of interrelated factors which lead ultimately to the disease. So obesity, family history, diet and lifestyle will all contribute to causing diabetes. So each of the factors, different factors, might be independently causing the disease, or they might need to come together and cumulatively they might lead to disease. So that was about the types of association and association. So the thing that you need to remember is that association does not imply causation, right? Association is something, just an event that is occurring more commonly than by chance, whereas causation has to fulfill some specific criteria. So in order for us to scientifically conclude that one thing is causing another thing, we need to fulfill certain criteria. So for example, in microbiology you have studied Koch's postulates. So these Koch's postulates were given as a criteria to determine the cause of a disease, to ensure that the microorganism is actually causing the disease. Similarly, in epidemiology, certain criteria have been mentioned to conclude that a factor is causing a disease, and that criteria is very important, is a criteria of causal association. The first criteria was given by US Surgeon General in 1967. It was later added to, additions were made by Sir Bradford Hill and more recently by Rothman. But we will stick to the criteria mentioned in your textbook. There are other factors also, but you need to know whatever is being given in your textbook. Now Sir Bradford Hill is very interesting. He is one of the most eminent statisticians in the world, and he was an Air Force pilot during the World War, and unfortunately he suffered from tuberculosis which left him debilitated, and he could not become a doctor. So he decided to become a biostatistician instead, and along with Sir Richard Dall, Bradford Hill actually came up with most interesting study designs in epidemiology, like the case control study design or the clinical trial, and both of them actually proved the causal association between smoking and lung cancer. So Sir Bradford Hill is again a very important statistician, and it can be asked as an MCQ question as well. So this is the criteria that your textbook mentions. The simplest way to remember it is TB/S2/C2, mnemonic. First criteria is temporal association. Then you have two criteria starting from S, that is strength of association and specificity of association. Then you have the consistency and coherence of association and biological plausibility. Okay, so temporal association, biological plausibility, strength and specificity, consistency and coherence. These are the 6 criteria that must be fulfilled in order to ensure causal association. Now what do you understand by temporal association? Temporal association is something that has to do with time. It simply states that the cause must precede effect. The infection must occur before symptoms of the disease manifest. Exposure must occur before onset of disease. Interval between exposure and disease is very important. In case of infectious disease, we call this interval as incubation period. So the time between infection by an agent and actual manifestation of symptoms is known as the incubation period, and this incubation period is variable in different infectious agents. Right? In case of non-communicable disease, smoking must precede the onset of lung cancer. So if the person develops lung cancer first and then he has started smoking, then we could not say that smoking is what caused the lung cancer. But we will find that actually the person has been smoking for the last 10 years, 15 years, 5 years, 10 years before he develops lung cancer. So we can actually show that the smoking was what was preceding the disease, that is lung cancer. So here you will see a diagram from a very famous study that you must all know, and if you are interested you can go and read those papers, they are very interesting. A study conducted by Sir Richard Dall and Sir Bradford Hill, published in the BMJ in 1950. It gives the association between smoking and lung cancer. Here you will see that they have graphically represented the deaths due to lung cancer in England and Wales and the consumption of tobacco. So you will see that in 1910 onwards, the consumption of tobacco has drastically increased in England. Okay, so 1910 के बाद से टोबैको कंजम्पशन बहुत बढ़ा इंग्लैंड में, और आप देखोगे कि 1920 के बाद से तुरंत कैंसर में स्पाइक हुआ. So approximately 10 years after people started smoking a lot or consuming tobacco a lot, they had a drastic rise in cases of lung cancer. So this is the temporal association, that is the cause, that is tobacco is preceding the effect, that is rise in lung cancer. The second factor is strength of association. Strength of association will signify, as we have already seen in correlation, there should be a high correlation. Okay, there should be a significant correlation between the factor and the disease. So the relative risk should be more. There should be a dose response relationship. The more you drink, the more likely you are to develop liver cirrhosis. Okay, so if you are drinking a lot of alcohol, you are more likely to develop liver cirrhosis early, right? Duration response relationship. The longer you are drinking or the longer you are smoking, the more likely you are to develop cancers. Okay. The more cigarettes you smoke, the more likely you are to develop lung cancer. So that is the dose response relationship and duration response relationship. As dose increases, likelihood of disease should increase. As the duration of exposure increases, likelihood of disease should increase. The next important factor is cessation. So with removal of exposure, the risk of disease should reduce as well. So if you are increasing exposure, the disease increases. But if you are removing the exposure, then the risk of disease should reduce as well. So if a person stops smoking cigarettes within 2 years of beginning smoking, then the risk of developing lung cancer will be less as compared to a person who continues to smoke. Or if a person starts eating healthy early in life, then his risk of developing diabetes will be lesser as compared to person who does not start eating healthy until later in life, right? So जितना स्टिमुलाई आप ज़्यादा दोगे उतना डिसीज़ ज़्यादा होना चाहिए, जितना स्टिमुलाई आप कम करोगे उतना डिसीज़ कम होना चाहिए. That shows strength of association. Specificity of association. Now it is a tricky one. It is difficult to establish specificity in real world conditions. You need a lot of experimental conditions to establish specificity. Specificity implies one-to-one relationship. That is, the one factor is only causing one disease. Okay. The problem is that in case of non-communicable disease, for example, if you take smoking as a risk factor and lung cancer as an outcome, not everyone who smokes gets lung cancer, and not everyone who gets lung cancer actually smokes. Right? So, in these situations, specificity is very difficult to establish. Whereas in case of infectious diseases, if you have Vibrio cholerae, you will develop cholera and not some other disease. Okay, so cholera, Vibrio cholerae will specifically cause a disease known as cholera. Here, in that case, specificity is seen, but in non-communicable diseases, it is very difficult to establish specificity. Consistency. Now this is just common sense. So association has to be found consistently in multiple studies. Whatever you find, other studies should also find the same association in order to for the risk to be consistent. So often just once after doing one studies, we cannot conclude the causal association. We have to do multiple studies, multicentric studies, that is studies in various parts of the country or various parts of the world, and if all those studies find similar association, then we can conclude that there is consistency in association. The last important factor is biological plausibility. It should be plausible. It should be within the realm of possibility. It should not be a fantastic hypothesis, right? There needs to be a credible biological mechanism which explains the association between those two variables. Simply statistical significance is not enough. But in certain conditions in beginning, that biological mechanism may not be obvious. For example, when it was found that eating fresh fruits, citrus fruits, will prevent scurvy, we did not know that there is a what biological mechanism is working when citrus fruits are consumed and scurvy is reduced among sailors. But we were aware of the association. The biological plausibility, that is role of vitamin C, was found out much later, right? So there has to be some biological mechanism which ultimately explains this association. Coherence of association. Coherence of association is that there should be coherence between the already known facts. For example, a study found that men have higher prevalence of lung cancer. Now this is coherent because we know that smoking is causing lung cancer and men smoke more as compared to women. So therefore it is logical that men will have higher prevalence of lung cancer as compared to women, right? So this is coherent, this makes sense. Now as more and more women start smoking, you will find that prevalence of lung cancer will increase in women. So this will further bolster our hypothesis that it is smoking that is causing lung cancer. Okay? So this is the coherence of association. So we'll revise what we have, the criteria that we have studied till now. The first is temporal association, that is the cause must precede the effect. Second is the strength of association, that is there should be strong correlation between the cause and effect. Third is specificity of association, that is the specific factor should lead to a specific disease. Third is consistency of association, there must be consistency in multiple studies, you should find the same things, same relationship. Fourth thing is the coherence of association, that is it should be logical, it should make logical sense. And biological plausibility, that is there should be a biological mechanism that explains the relationship. So these are the criteria that have been given by Bradford Hill. Apart from that, you must possess scientific rigor and judgment while attributing cause. Okay? So you should not reach hasty conclusions just by looking at association and statistical correlations. You must always question the hypothesis and try to replicate the results in multiple studies before assigning causal relationship. You must exercise your scientific judgment, and as an epidemiologist you must try to get to the cause of the causes. So there might be multiple superficially associated factors, but there might be very few actual causes that lead to the disease. And if you find the cause of the causes and you are able to reduce that cause or alter that cause, you will find that the disease gets reduced drastically. Thank you.